Good afternoon, respected judges and one and all. So I'll be presenting my paper on the topic an analytical study comparing the slit lamp exophthalmometry, a novel method, with HERTEL'S and CT imaging in quantification of axial proptosis. So aims and objective was to analyze and compare the accuracy and the precision of measurement of proptosis in cases of axial proptosis using a novel slit lamp method, and to compare it with the gold standard methods of HERTEL'S and CT based methods. So the inclusion criteria was more than 18 years with unilateral or bilateral axial proptosis, and patients with the proptosis difference of more than 2 millimeters between two eyes, and those with eccentric proptosis and traumatic fractures were excluded from the study. So this was the novel method of slit lamp exophthalmometry, where initially the apex of the cornea is focused as shown in figure A, and the initial arc is marked from the base of the slit lamp, following which the lateral orbital rim is localized with the help of a tip of a pin, and the second arc is drawn, and the difference between the two can be measured using the counting the number of small boxes between the two arcs as drawn here in figure D. So that is compared with the gold standard of HERTEL'S exophthalmometry as shown here. And we also have three ways of measuring proptosis using CT scan. And the first method is where there's a horizontal line between the two orbital rims. The second method is pertaining to unilateral cases. And the third method is from the sagittal section. So following which statistical analysis was done, and interclass correlation coefficient was chosen as a method of understanding the reliability, and Bland-Allman plot was plotted to understand the correlation of different values. So these are the demographic details of my study, where 46% of them were males and 54 of them were females. And let's move on to the results proper, where there is a comparison between the slit lamp and the HERTEL'S, which showed a significance of p-value of less than 0.01, which is statistically significant. And this is between slit lamp and HERTEL'S, where the Bland-Allman plot showed that most of the values were between minus 1.96 standard deviation, which is of significance. And following which, the slit lamp exophthalmometry was covered with compared with three different methods of CT, which is shown in the method 1, where the lateral orbital rims were the parameters, and here again it was proved out to be statistically significant. And this was the Bland-Allman's plot, which again showed a correlation between that of slit lamp and the method 1. And this is with the method 2, which is pertaining to unilateral cases between the medial and the lateral orbital margin, and that of slit lamp, which was showing statistical significance as well. And here is the Bland-Allman plot, which was also showing the standard deviation to be less than 2 standard deviations. And same goes with method 3. So all the three methods and the comparison with the HERTEL'S were showing statistical significance. So here is the graph of the same. So moving on to discussion, slit lamp exophthalmometry is actually a very simple and objective method which can be done in any of our outpatient departments. So having a method which is showing such a good correlation with that of the gold standard HERTEL'S exophthalmometry of 0.958, which actually shows that an ICC of more than 0.9 itself is supposed to be having a very good, or in fact an excellent correlational reliability. So that was one finding in our study. And the three methods, all of them showed to be more than 0.9 as well. This again was a point in favor of saying that using the slit lamp method can go a long way in sort of avoiding repeated CT scans, especially during follow-up. And one specific feature which we noted was that the CT method 1 correlated well, whereas the study by Park et al., where it compared the CT and the HERTEL'S, showed method 2 to be more correlative. But that was because the slit lamp method was more similar to the step 1 compared to Park et al., which was more similar to the step 2 or the type 2. So I would like to conclude by saying that HERTEL'S is a very commonly used method, and method of using slit lamp, which has quite good correlation with that, can prove to be a very good and a useful substitute for measuring proptosis in axial proptosis. Thank you. Yes, ma'am. It was done by the same person, principal investigator, which was myself, and in using the same slit lamp, ma'am. No, ma'am. It was pretty much restricted to axial proptosis itself. Yes, ma'am. Yes, sir. Actually, there was one study done in Japan, which was done with only 60 eyes, but I have done it with 80 eyes, and there they have compared it only with the HERTEL'S, but I have compared it with CT methods as well in a single study, sir. Yes, sir. The model of the slit lamp was same, but the company was different, sir. Ma'am, in fact, this was much quicker because the measurement was already like you just keep a slit lamp, the graph paper already set. So the patient just has to sit, measure. It took less than 10 seconds for me to finish this compared to the HERTEL'S, where we had to like get the HERTEL'S and positioning it in the lateral rim and measuring the baseline and then going for this was a tougher job. So it was much more quicker for me.